Bleeding after sex, should you be worried? Should you check it out first? Should you head straight to the hospital? Is it happening to me only, or is it happening to a lot of women? And what are the causes of bleeding during or after sex? Those are the things I'm going to cover in this video today. Hi guys, welcome back to my channel. My name is Melody and I'm a registered nurse. So bleeding after sex is called postcoital bleeding, and this can happen during the sexual intercourse. It's also something that can happen after. It can be a light bleeding, can be a heavy bleeding. Sometimes it's painful or it might even be painless. Bleeding after sex is something that happens to a lot of women. So the numbers or the prevalence depends on the age. So this is something that is more common in women who are menopausal, because during the menopause years, there is changes in the vagina as a result of hormonal changes and changes around the lining of the vagina and the cervix. All of this can cause dryness that will cause friction and bleeding during sex. However, for younger people, there are different causes as well. So it just depends on what is causing the bleeding. But just know that this is something that happens to a lot of women. So, having said that, what are now the causes of this bleeding that happens during or after sex? The first one I'm going to talk about is vaginal or cervical irritation. So, if the vagina or the cervix is irritated or inflamed, it means that they can easily bleed. So, if you have STDs like gonorrhea, chlamydia, trichomoniasis, all these kind of infections, they cause irritation to the vagina and to the cervix. So, you can easily bleed during sex. Other infections like bacterial vaginosis, even yeast infection also cause irritation to the vagina, and then it makes you prone to bleeding during sexual intercourse. Another irritation that can happen to the vagina or to the cervix if there are polyps. So polyps are like small growths that are not cancerous that can be found in the vagina or the cervix. If these polyps are present, it means that once the penis is inside, it can irritate it and also cause it to bleed. The second thing that also causes bleeding during sex is if there is vaginal dryness. So vaginal dryness means that there's no lubrication for the penis. And if there's no lubrication, it means that the woman is going to be in pain, and the woman can also bleed because of friction that is happening because of vaginal dryness. So vaginal dryness can happen if there are hormonal changes, especially during menopause where estrogen drops. Also, if a woman is breastfeeding, she's also more prone to vaginal dryness because of hormonal changes. Certain medications as well, they also cause vaginal dryness. If you think you have vaginal dryness, you can buy water-based lubricants to use, and or you can see a doctor if it is something that is concerning for you. But if you constantly find out that you are in pain, your vagina is dry, you are bleeding during sex, I don't think you should continue without doing anything about it. I've made another video where I talked about painful sex for women, the things that can cause painful sexual experience, and I kind of did like a detailed explanation on causes of vaginal dryness. If this applied to you, I think you should watch that video. Another major cause of bleeding after sex is uterine condition. So the first one is mostly fibroid. So fibroid are non-cancerous growths that can be found in the uterus. It's very common and it affects a lot of women. Depending on where these fibroid tissues are found in the uterus, it can cause vaginal bleeding during sexual intercourse. Another one is endometriosis. So endometriosis is basically where endometrial tissues or tissues that are supposed to be lining the uterus, those tissues are supposed to be found only in the uterus. You start finding those tissues in the cervix, in the fallopian tube, sometimes in the intestine. Just basically, it can be in any part of the body. So these endometrial tissues, they kind of mimic the uterus. In severe cases, it can cause vaginal bleeding during sexual intercourse. It can also cause severe menstrual pain for people who have this condition. So if you've watched this video to this point, why have you not subscribed? Please try and subscribe. I promise you there's lots of things to learn from this channel, and it will also be a way to support this channel to grow. So if you have watched this video to this point, please just pause it and subscribe. It's free to subscribe. Another cause of vaginal bleeding is vaginal cancer or cervical cancer. So while this might not be the only sign of cervical cancer, or even in some cases of cervical cancer, the person might not also bleed, but it can be a sign of cervical or vaginal cancer. So if you notice you are bleeding during sexual intercourse and you think it's not happening because your vagina is dry and it keeps happening, please do not ignore it. Please do not ignore it, especially if you are over 35 years, and especially if you have not had a smear test in a long time. Please, if you notice it, please run to the hospital. You need to be checked. So having mentioned all of these factors, when do you actually need to see a doctor? First thing you need to know is that having bleeding during sex is not normal. That is one thing that you should have at the back of your mind. However, if some of these factors apply, you should immediately see a doctor. One is that this bleeding is happening more than once. One thing you need to differentiate is that make sure this bleeding is not because of your period. It's not just before your period, or maybe your period just finished, maybe 2 days, 1 day ago, and you still have some discharge coming out. You need to make sure that this is not your period blood coming out. If you have been able to determine that this is not your period, and you see this kind of bleeding more than once, then you need to see a doctor. If the bleeding is heavy, you also need to see a doctor. And if this bleeding is accompanied by pelvic pain or discomfort, then you also need to see a doctor. If you are pregnant and you are bleeding after sex, please don't ignore it. Immediately get yourself to a hospital. And also, if you haven't had a recent pap smear, so pap smear is a test that you do to check for HPV and also check if there are any changes in the cells in the cervix, just to determine if you are at risk of cervical cancer. So if you haven't had this test in a long time, or you haven't had this test before at all, you should definitely see a doctor. So in the meantime, what can you do? The first thing you should do is that if you notice that you are bleeding during or after sexual intercourse, you can pause having sex at the meantime until you are able to find out what the problem is. Also go for regular check to check for sexually transmitted diseases as well. If you have an STI, make sure you treat it. You can get a pelvic examination done. Please make sure you stop having sex at the moment until you find out what is happening, what actually is the problem, before you continue having sex. Stay up to date with pap smear. So to conclude this video, I'm going to tell you that bleeding during or after sex is something that is common. It is treatable. It does not always mean that you have cancer or any serious condition, but if you don't understand what is happening, the best thing is always to have it checked out. Thank you guys for watching to this point, and if you found this video helpful, share it to somebody else that might benefit from it, and also subscribe to my channel. Thank you guys. Bye bye. See you in my next one.